Hello and welcome everyone. Thank you for joining us today for our Case Western Reserve University Public Health Ethics webinar hosted by the Department of Bioethics and the Masters of Arts in Medical or Bioethics and Medical Humanities. I'm your host, Sam Hamilton. I work in the enrollment management office, and so I will be helping with any of the different pieces in the background. So if you have any questions or things like that, feel free to chat them. I will be the one moderating those. And I'll go over the agenda with you. So first off, we'll talk about our School of Medicine and actual Case Western Reserve. Then we'll get into the meat and potatoes of today's presentation about public health ethics, which I'm very excited about. It's probably one of my favorite topics that I hear about every year from our panelists. And then we will talk more about the actual MA in Bioethics and Medical Humanities and the different pieces that go along with the program, including the application process and deadlines. And at the end, we will get into a Q&A. And for any questions, feel free to send them our way. There are two different ways that you could potentially send them depending on your device. If you're on a desktop, then you're probably going to look at the top of your screen and you're going to see an icon that looks like two little chat bubbles. You'll click on that and then you'll submit your questions that way. Or if you're on a mobile device, it'll be to the left side top of your screen. There'll be three lines. You'll click that and it'll give you a menu that'll say Q&A feature. And you can send your questions in that way. Without further ado, though, I do want to say hello to our panelists and invite them to speak. I don't know if Dr. Jeannette wants to go first or Dr. Goldenberg, but I will let them take over the floor.
Dr. Goldenberg, I'll let you introduce yourself first.
Sure. Hello, everybody. I'm Aaron Goldenberg. I am Vice Chair and Associate Professor of Bioethics in the Department of Bioethics here at Case Western. I have been with the department as a faculty member for now almost 14 years, but I've actually been associated with the department in one way or another for over 20 something years. I actually did the master's program that we're going to be talking about today in 1999, and then came back, did my PhD here in the department, stayed on as a researcher, and then joined the faculty. And so I have a long history with the department. It's a department I really, truly love, and it's been a real joy to kind of grow up in academia in the department, and now to be able to share it with new students and new prospective students. So I'm excited to be here and talk with all of you.
All right, I am Leah Jeannette. I am Assistant Director of Education and a Senior Research Associate in the Department of Bioethics. Actually, similar to Dr. Goldenberg, I actually started out as a student in the master's program as well. I was in the 2008-2009 class, so a little bit later, but I actually met Dr. Goldenberg while he was a PhD student. So I've known him for quite a while through the department. And after I graduated, I left and went and got my PhD in bioethics at Duquesne University, and then came back to Cleveland and Case Western Reserve to work here in education and clinical ethics. I kind of fill many different roles interacting with our incoming students, our master's program, teaching, clinical ethics, kind of all different kinds of things. But, you know, as I was kind of preparing for this webinar, as I was looking at this slide, I did kind of chuckle that it was both Dr. Goldenberg and I on this slide. I was like, oh, look, two alums. So it's great to be able to talk about this program and the public health ethics aspects that are here. And, you know, feel free to, ask questions as we go throughout. So a little bit about Case Western Reserve and the School of Medicine, I think, is a great place to start. So we are, a great university. There's a lot going on here, particularly our School of Medicine is very well known, both in Ohio and across the United States. But not only the School of Medicine, the social work program, the law school, the nursing school are also very highly ranked. We do a lot of collaboration. There's also a lot of research going on. And so I'll let Dr. Goldenberg talk a little bit more about that, considering he's the director of research. He can speak much more about that than I can.
Sure. Yeah, one of the things is being a student in the MA program and then in the PhD program and then a research assistant and then a faculty member, is I've been able to actually see the growth of research in our department. And a lot of people say, well, what's, research in bioethics? And it really varies. It's really amazing to see the kind of scholarship that our faculty and our staff really work diligently on here in the department. We have one of the longest standing groups that do research on genetics and ethics. So the kind of ethical and legal and social issues that come up in genetics. We have research on ethical issues within the context of infectious disease and COVID. We have research going on related to mental health research and ethics. We have research in areas of death and dying and issues at the end of life. And so really any issue you could think of in the area of bioethics, we have some kind of scholarship. And one of the things that I really value about our master's program is that there are lots of different ways that master's students can get involved in research, either just hearing about it, coming to seminars, being part of our department as a student, in a learning environment, but also actually getting their hands into some of the research and in becoming research assistants, working with different faculty, learning research methods, and that's something that I think is somewhat unique. Is the number of research opportunities that our students have, and that can help them in really whatever career trajectory they go in to have that research experience. And I would say, a good portion of our students get some research experience while they're here, and that's just really an amazing thing.
So, one of the big questions that I think we often hear is, why study public health ethics? Why study bioethics, medical humanities? I even get that question as someone who is a bioethicist, right? Well, why study it? And as you can see, from the screen, there's constant advancements that lead to kind of these big questions. But, I think there's a lot more to be said too, right? Especially in the public health ethics space, there's a lot that's going on in these intersection points. Dr. Goldenberg, I'm sure you can have much more to add to this.
It's interesting. I think if I were to be doing this webinar 2 years ago, almost for a little bit, maybe 2 years and a few weeks ago, I think a lot of students would say, well, public health, yeah, it's interesting, it's important. Maybe there's some ethical issues here or there. We're clearly in a very different world now, and I think in a mid or post-COVID world, I think asking the question, what is public health ethics, or why is it important for bioethics? Why is it important for medical humanities? Is so much of a part of what the last few years have been like for the development of treatments, for the establishment of mask mandates, for the development of vaccinations and thinking about vaccination policies that many schools or employers have had to put in place. I think, the idea of the connections between public health and public health ethics and bioethics are so much a part of our day-to-day existence these days that, for me, it sounds funny, but for me, it's like, why would you ever not want to study this? Why would you ever not want to think about what the ethical issues are for establishing a mask mandate or ending a mask mandate? How do you make those decisions? How do you balance individual freedoms and individual choice with community benefit? I mean, wow, I can't think of any time in history in my lifetime where we've had to face some of these kind of balance questions in a way that really have divided us in some ways, but has raised to the forefront the important questions that public health and bioethics need to confront around, maintaining individual freedom, maintaining individual choice, and at the same time, sometimes having to make really difficult decisions where one's choice may be forfeited in favor of protecting our community, protecting our families, protecting each other. And that essentially is at the heart of public health ethics. So literally we've been living a live, I think I'll say this later, but we've been living a live case study of public health ethics. And so I think, one of the reasons why I really love our kind of public health ethics sessions, why I love the courses, why I love our dual degree in public health and bioethics, is because increasingly, whether it's an infectious disease or rare diseases, increasingly some of these big questions in public health have significant ethical questions. So many of you on this call may be even thinking about the decisions you've made for yourself over the last 2 years, and what kinds of moral and ethical questions you maybe have had to ask about yourself, about your family. Do I go on vacation? Do I not? Do I wear a mask? Do I not? Do I get the booster or do I not? All of these questions create some kind of moral calculus that we have to do to think about our own decisions, our own choices, and what that means for our community. You can go to the next slide. So that kind of raises this question, then what is public health ethics? So if you keep going, I like to start with a story when I think about public health ethics. And when I say the story of Jon Snow, I do not mean this one. This joke was a much funnier back when Game of Thrones was a lot more popular. But what I'm talking about is this second picture. This is Jon Snow, a doctor, an epidemiologist, and scientist from England. You can go to the next slide. In the mid-1800s, there was a very large outbreak of cholera all over London. It had at that time led to 10,000 deaths and was kind of spreading across the city. Now, you have to remember that at this time, cholera was not, you didn't really have germ theory yet. The idea was that you'd get sick from breathing in bad air, what were called miasmas. And the idea was that if you smelled bad air or you were around bad air, you'd get sick. So no one really knew where the cholera epidemic was coming from or how it was being spread or how to stop it. Jon Snow was really, a lot of people call him like the father of modern epidemiology. He created an outbreak map where he went door to door around different areas, and specifically in the area of Soho in London, and created a map, and we'll see the map on the next slide. If you want to go now to the next slide. This is his outbreak map. This is a really famous map in public health. And you can see that areas where you see kind of more of these black bars it is where our households or tenements where you had higher levels of both sickness and death from the cholera epidemic. And by mapping out where he saw higher levels of cholera, Jon Snow was able to figure out that it really had something to do with the water system. People who were getting their water from the Broad Street pump, you can kind of see it right in the center there, were getting sick at a much higher rate than people who were drawing their water from other pumps around the area. Jon Snow was able to use this data to derive that cholera was waterborne, and that by recommending that people not get their water from Broad Street pump, they would be able to get cleaner water from other pumps. So the Broad Street pump was gathering its water from kind of downstream on the Thames River, where there was a lot of pollution and garbage and sewage and waste. Other of the pumps got their water source from higher on the river, where there wasn't as much pollution. And the story goes that he went and he removed the handle from the pump to prevent people from drinking water from that pump. We don't know if that's actually true or not, but that story is linked to a huge downturn in cholera. It was a huge a turning point in the epidemic. And it's kind of looked at as the symbol, as a great example of what public health can do to prevent disease. But this does raise some interesting ethics questions. They collected this data from house to house. You know, what if Soho residents didn't really want their information to be collected? Would they have had a right to not have their information collected? What about this idea of someone knowing where you're getting your water from or where you're traveling? Do we need to be monitoring people's movements and travel? Should we be restricting people's movements and travel? The idea of removing the handle means someone has to go further for their water. Is that fair? What if some of the Soho residents did not have access to other sources of water? So what if you only could get your water from the Broad Street pump? Would that create a disparity between people who could access water from other sources or this? So I raise these as somewhat hypothetical questions, but they're really, really important because we need to start thinking about how public health interacts with the public, how it interacts with other sectors of health. And as Callahan and Jennings said in 2002, public health raises a set of different moral problems that extend beyond what we typically think of bioethics, right? That they require their own ethical analysis, their own thinking. And one of the things that we do in our program is we try to allow students to see bioethics through different lenses. And one of those lenses is a public health lens. And I think, again, this is me personally, but I think lots of people would agree now, public health is rapidly growing into one of the most important lenses that we can be viewing some of these moral problems. How do we, again, as I said before, balance the need to assure people can be healthy, that we can reduce health disparities, that we address equity questions? How do we make sure that we're protecting our community and our families and our populations? And at the same time, how do we also maintain some level of individual rights, individual choice? These are at the heart of public health ethics. And really, if you were to join our program, one of the things that we talk a lot about is how do we approach these questions? How do we look through these different lenses in ways that allow us to use philosophical traditions, medical humanities traditions, public health traditions to answer some of these really difficult questions. Go to the next slide. So as I said before, we are really living a live case study for these questions, right? We know that there are going to be infringements on individual freedoms. For example, mask mandates in public spaces. That I agree with those mask mandates, but it is a it's a violation, but it's a limit on someone's personal choice. Travel restrictions or mask mandates, so shutting down airports or shutting down international flights during COVID is another example of the role that the government can play in protecting health of its citizens. Resource allocation, a third area that is really, really important. We know that at the height of a variety of the variants of COVID, we had shortages of ventilators. We had shortages of vaccines. We had to triage and figure out who was going to get the vaccine first, who would get it second. And we did that in a way that was meant to allocate resources in a just way as much as possible, and in a way that recognized the need for us to be thinking about what that fourth area is, which is health, justice, and equity. Right. One of the things that we really thought a lot about and really saw is that individuals who were already living in health disparities communities had much worse outcomes during COVID. They caught COVID at higher rates. They had worse outcomes from COVID. They had higher death rates. And we really needed to think very strongly about some of the equity questions and the justice questions that arose during COVID and that we're still seeing. And so each of these areas is something that I and others in public health ethics have been thinking a lot about. And I actually think we're at a turning point in bioethics where we really do have to start asking these really important questions. How do we weigh individual freedoms versus community health? How do we see the role of the government, especially in an era where there's lots of mistrust of government agencies? How do we allocate resources justly and fairly and try to get help to as many people as possible? And then lastly, how do we address health disparities? How do we think about disparities where things like a pandemic actually exacerbate disparities and we see higher levels of disparities in many communities? That is really some of the things that are at play within the context of public health ethics. Next slide. So I can talk a little bit about this. I'll start, but then I'm gonna hand the mic back to Dr. Jeannette, who can talk a little bit more about the program and answer some questions, and I'll stick around to answer some questions as well. Right, so how does bioethics, medical humanities, and public health ethics help your career path? Well, there are lots of different things you can do with a bioethics and medical humanities degree. One is the career path that I took, which is, and that Dr. Jeannette took. We are bioethicists. We went a path where we developed a career based on bioethics and medical humanities. But many of our students take this degree and use it in lots of different ways. They help to launch students in a number of professional careers, clinical and legal professions. We have people who go on to medical school. We have people who go on to law school. We have people who do policy work. They go on to regulatory work. We have a number of alumni who are working in policy shops in DC and elsewhere. We have a number of students who deal with arts and humanities and health humanities. We have a number of people who want to get public health degrees or get public health degrees while they're doing our program, and they're working for health departments or working for health advocacy organizations. We also have a lot of students who come in. So we have students who come in and they know exactly what they want. They say, I want to go to law school. I want to go to medical school, or I want to be a public health professional. Many of our students come in and they're not quite sure what they want to do. They know they want to do something in health. They know they want to do something maybe health advocacy, or they want to do something in arts and humanities. Our program can help students make that decision, to learn more about different aspects of fields, to be introduced to different clinical settings. That's actually one of the things when I did the program, I didn't really know what I wanted to do. And this program, both through our clinical hours, through our classes, helped me to define who I am as a professional and how I wanted to interact with the health sector, and how I didn't really know if I wanted to be a doctor, maybe not. I didn't know if I wanted to go to law school. And I got really passionate during our program for public health, and I got really passionate about bioethics, and it led me to go down that road. And so our program can also help people who are maybe undecided or unsure what they'd like to do. Dr. Jeannette, I'll hand it back to you, and maybe you can fill in some of this as well.
Yeah, I think you exactly hit the nail on the head, though, that the students that come to our program have such a variety of backgrounds. So there isn't one particular major that students come to us with. There isn't one specific career path that students go on to do. And it's because of the interprofessional and multidisciplinary nature of bioethics and medical humanities. And it makes for such rich discussions in the classrooms, in the hallways, in the events that our program and our department offers. But it also allows students to do this program and launch into such a variety of professional careers and directions. And it's kind of amazing, the variety that students go on to. So yeah, it's amazing. And as Dr. Goldenberg said, he and I are just two examples that both happen to be in bioethics, but also are in very different areas of bioethics. So I spend a lot of time doing clinical ethics in the hospital, and Dr. Goldenberg spends a lot of time doing public health and research and different space than I do. And so while we're both bioethicists, still very different areas of bioethics. We are in our 26th year of our master's program. So for students who complete our program, it takes 2 semesters. There is an option for part-time, but some of the big highlights of our program is that there's personalized advising. Our curriculum is very customizable, so approximately half are electives. We have something called student assistantships, and that is an opportunity for students to have a partial tuition waiver. It really helps offset that tuition. And then we have 2 optional concentrations. You don't have to do a concentration, but it's a way to deep dive into medicine, society, and culture, really a medical humanities focus. And then also a research ethics concentration. And then we also have dual degree options. These dual degree options, there's a variety of them, including one that focuses on bioethics, medical humanities, and public health. If you want to learn more, you can reach out to us to talk more specifics. One of the big features of our program is the clinical ethics rotations. It's essentially 160 hours of clinical time inside public and private teaching hospitals here in Cleveland. These are our 4 hospitals here. Cleveland Clinic, Metro, the VA, and University Hospitals. These are fantastic opportunities for students to be in the clinical setting. We have short-term study abroad electives for students, 3 credit hour electives that students can spend anywhere from a week to 2 weeks in an international location or a domestic, including US national parks. It's a great way to focus on a unique bioethics or medical humanities topic. Applications and application requirements include a transcript from undergrad or grad programs. Statement of purpose is looking specifically at what your interest in bioethics and medical humanities is and how does it fit into your career path. 1 to 2 pages is plenty. A CV or a resume, 2 letters of recommendation, including 1 from a faculty or professor. And then once we have that completed application, we review, and then there's an interview with an admissions committee member. And when we have a completed application, we can typically render a decision within 2 to 3 weeks. So it's a pretty quick process once we have a completed application. And then deadlines. So the next kind of big deadline is our priority 2 deadline. It's May 15th. If you want to apply for our student assistantship program, which is an opportunity to get involved in teaching or research or administrative work within our department, in exchange for doing that, you get a partial tuition waiver. You do need to apply to the master's program by May 15th and then submit your student assistantship application by June 1st. And then the final deadline to join us this upcoming fall, oh, that's a typo, it should be fall 22, is August 1st. So we'll take some questions from anyone. So I see a question, what kind of work would you do during the clinical rotation? That's a great question. So there's kind of 3, as we call them, like categories of opportunities in the hospitals. One is you're going to different rounding opportunities. So you're spending time in ICUs, on medical floors, interdisciplinary team meetings, and just being with different medical teams. And each of the hospitals here in Cleveland have different specialties. So, you know, Metro has a burn unit. So you're spending time in the burn unit. You know, University Hospital has rainbow babies and children. So you're going to be seeing a NICU, a PICU. The second category is committee meetings. So going to ethics committee meetings, institutional review board meetings, policy committee meetings, transplant committee meetings, animal research committee meetings. There's just a whole litany of different research types of meetings or just committee meetings in general. And then the third category is going one-on-one with different healthcare professionals. It could be physicians, nurses, physician assistants, nurse practitioners, but it also includes allied health services like social workers, chaplains, genetic counselors, as they see patients, as they meet with them in different appointments. So, and the goal is that students are extracting kind of that ethical issues, those clinical ethics considerations, and kind of digesting that. And you get together weekly with fellow students to see kind of what's going on.
Hi, Leah. There's also a couple of pre-submitted questions that I do want to get to as well, because I think those are important. One of them is actually for Dr. Goldenberg, and it's, I know this is a rather large question, so it might not have a ton of time to be allocated to getting into the nitty-gritty, but the student was curious about the public health ethics and the implications of vaccine allocation, which I'm sure is surrounding a lot of our interest because of COVID-19 and all the things that have happened recently.
Sure. I mean, it's a big question. That could be a whole hour. What I'll say is that from an ethics standpoint, one of the things that the government and health agencies had to do was to weigh, on one hand, vulnerability, right? So that's one of the reasons why 65 and older got those vaccines first. On the other hand, we also had to weigh what might be called clinical utility or clinical, I'll just say clinical utility, but, making sure, for example, that doctors, healthcare workers, frontline workers, ambulance drivers also got the vaccine because of their role in taking care of people who were sick. And so there was this balance that also needed to happen then, where on one hand, you wanted to think about vulnerability, and on the other hand, you also had to think about, optimizing taking care of people, and then go from there. Luckily, we had enough at the beginning to be able to do both, to be able to open the vaccine up to healthcare providers and the elderly. However, in some cities it was harder. Some cities there was delays. And again, it's that kind of the need to weigh kind of community needs, individual needs. We could and we will in the program do a whole session on this. But really, it's that social utility, like doctors, like clinicians, and vulnerable populations. That really is where it came down to. So that's a very quick answer because I know we're out of time, and I want to make sure we get to a couple other questions. I also see one question that I'll just answer quickly.
Yeah.
Does the program look and address healthcare inequities or inequalities? Yes, I would say that every single unit, every single course in our program, in one way or another, addresses inequities and healthcare disparities. Health equity and health justice is one of the central tenets of bioethics, and is an essential part, a crucial part of almost everything we teach. And so I can't think of a topic that we teach in the program that doesn't, in one way or another, address those issues. So yes, if that's an interest of yours, our program, I think, does a really good job of addressing those things.
Awesome, thank you. And there's one more pre-submitted question that I want to get to, and I think that's all the questions for today. And it's also for you, Dr. Goldenberg. It's a longer question, so I'm trying to bring it down to more of a synopsis, but the student has noticed that in some areas within the healthcare industry, public health departments have been going extinct, but in other areas they've been expanding. And what have you seen in the industry so far? How do you see public health playing a bigger role within healthcare and ethics and all those different places?
It's a great question. I'll give two quick answers, and then I'm happy to, if the person who submitted this would like to talk more, I'm happy to talk offline in the future. So yes, public health agencies, very few public health agencies fold or go under. Many of them just shift kind of what their focus has been. And it's interesting, in the 1970s, when many of the infectious diseases were not quite as common, we saw many public health agencies moving from infectious disease to things like chronic diseases, heart disease, cancers, and that's really, really important. Then in the HIV era, we started to see more attention back to infectious disease. And now we're starting to see even more. And so public health agencies have to then kind of shift their focus back towards infectious disease. Now, what that means for public health agencies is that they have limited funds. Public health is not a very super well-funded, maybe it will be hopefully in the future more, but it's not a super well-funded area. And so health agencies always have to make these decisions over what they're gonna cover and what they're not. And I would say that in the past, there was less coverage of infectious disease because many people thought, well, it's not such a big deal, right? Many of the diseases that we saw in the 1800s and in the early 1900s have vaccines. They're gone. Flu, we can kind of handle through our vaccines. And now what we're seeing is that infectious disease really is a threat globally. And it's always been a threat in many countries, but even more so just on a much larger scale now. And so we're starting to see public health agencies having to shift back more resources towards infectious disease control in ways that they hadn't in the last few decades. And so I think that also means a shift in public health ethics to much more attention to the ethics of infectious disease and what that means for health inequalities, those kinds of things. And so I think there'll be more to come on that as we start addressing some of these larger issues. But thank you for the question. It's a very thoughtful question.
Awesome. I think that we've answered all the questions. I don't see any more coming through. I know that Leah, I will let you give you the closing remarks.
Yeah, I will just say, if you have any questions about anything we talked about today, anything about our master's program, please feel free to reach out to us. We are happy to, continue this conversation or start a new conversation. We are so happy to talk with you. The best way to get a hold of us is bioethics@case.edu. We're so thankful that you joined us today. This has been a great opportunity to talk about public health ethics. And thank you, Sam, and thank you, Dr. Goldenberg.
Thank you all. It was wonderful to talk to all of you. I hope to hear from you soon.
Yeah, thank you all so much. We really appreciated all of your time and all of the questions.
Bye, everybody.